Going live. Okay. All right. We lost the jingle there. This is the Sumpon Global TV. We are here again for our usual Monday slot. Okay. And today we are going to be having another interesting topic, of course. Very interesting topic on health. We are queuing in again with health that we had last week. And before I introduce myself, let me give you the topic for today. Our topic: the effect of COVID-19 on economic activities and families in Africa. I am your host, Bolifo Elvis Ambe, and today I will be anchoring 1 hour, of course, with a very powerful guest and speaker that I have on the panel, who is none other than Esther Ainabi. I hope I got the name correctly. Esther Ainabi is a socio-economic, sorry, is a humanitarian, public health practitioner, and a trained teacher. I think when I will be giving the microphone to her to better introduce herself, it will interest you to know equally that we're talking today about the COVID-19 and how it is affecting the socio-economic activities and families in Cameroon. And we will equally like to know that the outbreak of COVID-19 has caused serious disruptions in the lives of people all over the world. In effect,
Yes.
governments have elevated this pandemic to the level of national security and measures to minimize its spread. In Africa, the spread of this infection across the continent has seen extraordinary responses like mandatory quarantine, social distancing, border closures, travel restrictions, bans on social and religious gatherings, and sometimes curfew in countries. While these measures have partially contributed to Africa's low infection rate, they no doubt have adversely affected the socio-economic and political landscape as well as our families. And today, Esther Anaibe will tell us about the effect actually of coronavirus, COVID-19, as it's called, how it is affecting our society, how it has affected our economy, and how it has affected families in Africa. Thank you, ladies and gentlemen. Thanks for joining us. This is Second Global TV. And join me, welcome, Ma'am S.
Thank you so much.
You're welcome to Second Global TV.
Thank you very much. It's good to be here. I greet everyone from wherever you're watching us from around the world. Thank you for joining us.
Thank you so much. Can we know a bit about you? Who are you? What do you do? You are a humanitarian, public health professional, and a trained teacher. Can you tell us about yourself?
I am Ehi Esther Ainabe from Nigeria. I have a master's in environmental and public health microbiology. I am a licensed and certified teacher by the Teachers Registration Council of Nigeria, which means that I can teach anywhere in the world. I am a licensed environmental health officer. I am also a humanitarian. I am a UK certified trainer. And I have a love for learning. I learn on a per second billing, on a per second rate. So I'd like to say that it's an honor to be here with us because every opportunity to interact with humans of value like you is an opportunity to expand my horizon. So this is just a little about me. Thank you for listening.
Thank you. I remember you are a transformation strategist. You say using mindset, and emotional intelligence to transform life. Can you tell us a bit about it? It's so interesting.
Okay. A transformation strategist is someone that is interested and passionate about changing the mindset of people. Now, a huge part of our lives, what we turn out to be in life, is connected to our mindset. As a man thinketh in his heart, so is he. So for you to become a global icon, it must first happen in your mind. And as such, because I have been into training for several years and I've been into volunteering for several years, I discovered that the Human Capital Development Index right now in Africa is not where it ought to be. And I took it upon myself to come into that area and see how we can use education, a new kind of education, patriotism, love for one another, taking out politics from the workplace, doing things the right way, taking out procrastination, and understanding that we don't have to wait for people to come and do things for us here in Africa. We don't have to wait for other people. We don't have to put the blame on others, but take responsibility for our life, leaving the comfort zone. So, as a transformation strategist, we'll work together on resetting your mindset to help you see that you are the meaning that you have been searching for. You are the meaning that the world needs to be able to get ahead. And then using emotional intelligence, we'll be able to communicate better. We'll be able to understand that self-awareness can help us in our relationships, at work, in our marriages, in our families, and it's actually a huge work because behavioral change takes time.
Thank you very much. I must say that you are joining this platform for the very first time, and your question really is right from about. You say we do not have to wait for others to do our things for ourselves. And we call it that we can use emotional intelligence to communicate, and that we call it stop the playing game. Thank you. We are going to coin a topic for that, and we'll be coming back here to tell us more about human experience, emotional intelligence, and how we can use this to communicate. Remember, today we're looking at the effects of COVID-19 on the
Yes.
socioeconomic activities and how this has equally affected families in Africa. And you will, those who are watching us will actually be asking the question, what is this COVID-19 and why is it so called? That is our first question. What is
Okay.
COVID-19 and why is it so
Okay.
called COVID-19? Is it a disease that was coined just to, have grief for us in 2019? So what is it all about?
Okay. COVID-19 was coined. The 19 has to do with the year in which it occurred. Then the COVID has to do with the name. It is a coronavirus. Okay, the COVID, the CO means corona, then the VI means virus, then the D means disease. So it's an upper respiratory infection that could linger for some time, but depending on the age, depending on the the environmental conditions, some person, especially based on age, most times people often recover, and some persons are even asymptomatic to it. They may have it, but they will not show signs of it. So that is how the COVID-19, the name came about. The 19 means the year in which it was discovered. Okay, it's an
Okay,
upper respiratory disease.
all right, upper respiratory disease
Yes,
discovered in 2019 and was baptized coronavirus disease
yes.
19. Thank you very much. People equally uh, asking the question, where is this disease from? We have said
Okay.
about the name,
The,
where is
okay,
this
the
disease?
the particular disease started from Wuhan, China. Yes, started from Wuhan. This particular strain of the disease that we're talking about started from Wuhan, China.
okay, started from China. But today, you will share with me that every part of the continent, every part of the world is suffering with this disease with alarming death rates, which is causing a very great problem to all the economy, all the households, and even hospital facilities are not able to contain the number of people who are there, even that they need serious intensive care that they need to follow up carefully. And if you go by the very first eight value, the airway, breathing, that bleeding, and something, the cardiac system. And if it's affecting a lot, that airway, which is one of the very first things that in first aid we pay particular attention to, because it is a disease that we really have to do something so that it doesn't have to linger around for so long, even if it's been around for so long. So, how does this disease spread? Because now we talk of
Okay,
face mask, wearing of face mask, we talk of distanciation, we talk of washing hands regularly. So some people are asking, is it like corella that we have to wash our hands every time? How does it spread?
okay. The disease spreads by contagion, meaning that it spreads by contact. Contact with what? Contact with fluids from an infected person. Most times we call it, for example, when you sneeze, what comes out from the nose and mouth, we call those drops of saliva droplets. Okay, so if anybody comes in contact with the saliva of another person, if anybody comes in contact with the body fluids of another person, the person will be able to contact coronavirus. That is why we emphasize primarily hand washing, because you don't know who had touched the last surface that you decided to touch, like the doorknob. You don't know who sat in the car that you committed in the last 5 minutes, and you do not even know who you're speaking with, because sometimes when we talk, some drops of saliva could leave off us and drop on the other person's mouth or nose, anywhere that there is mucus, anywhere that there's an entry into the body. Once any of the fluids from the body gets in there from an infected person, that person can get infected. So it is by contact. Contact. That is why we say cover your nose, use the mask, cover your nose, ensure that you maintain social distancing, because we don't want you to come too close together. When you come too close, you are going to be contacting or spreading, even as an asymptomatic person, that particular virus.
Thank you so much. I have one word when I look at transportation, public transportation, we have said we are not supposed to touch infected surfaces. And I see most of our buses here, our taxis, they keep carrying people go in and out, and they insist on the wearing of face masks. And now you're telling us that you are still avoiding touching surfaces. In a situation like a train that is moving from one angle to the other, not having time to stop somewhere so that all the chairs are disinfected, the environment is disinfected. How do you think that? Do you think that the wearing of face mask and non-touching of places is really an effective measure to curb the spread of this disease?
I believe that the wearing of face masks can actually curb this disease, because all of the measures we're not taking them in isolation. If we're saying use your face mask, it means that the moment you alight from a bus, the moment you leave a public place, the next thing you should do is to wash your hands. The next thing you should do is to be conscious of the fact that your hands, because the hands are are very, very important in terms of getting the disease or not getting it. So if you are in a bus with someone that is infected, you are wearing your mask correctly, not putting it over your mouth only, making sure it's covering the nose and ensuring that you are wearing it, it's protecting you from giving it to another person if you're infected, or from taking the virus in if you're not infected and there's someone infected around you. That mask alone can actually help. It can help to a large extent because of the particles of the virus. Now, the moment you leave, the thing is, we are not really conscious of these hygienic measures. Oftentimes, you find out that people don't even wash their hands up to 5 times in a day. Sometimes they don't wash up to 2 times in a day. And the next thing, you see the person putting his hands in his nose, or the person putting his hands in his eyes, the person putting his hands in his ears. Now, all of these places have mucor. The eye, there is mucor. Once the hand goes in there, it will just go directly into the body. Now there's mucor inside the nose. There is saliva around the mouth area. So any opening in the body, once that unwashed hand goes in there, there is a problem. So it is not even the wearing of the masks only that is the same. Wear the mask and also observe hand washing. Very, very important. So with that, we can curb, we can really reduce.
Thank you very much. You see, what we allied from the person, the very first thing to do is to wash our hands. Thank you very much for insisting on the point of hand washing, which, as you see, hands are so important. And sometimes we touch even on contact without knowing that the area was spoiled fluid which was contaminated. And now, another worry that I have is that there are some viruses, some diseases that affect particular set of people or group of people. Like we have the polio. We will be when you talk of polio, you're thinking about the children. You talk of measles, you think about little children, toddlers. And now, who are those who are actually affected by this virus, COVID-19? Who are those who are more vulnerable to infected with the virus?
Okay. When we talk about those that are more vulnerable, we're talking about the aging and aged, those that are, let's say, from 50 and above. So we're talking about the tired range, the tired, those that are aging and just trying to manage their health. So they are the ones that are more susceptible to this virus. They are the ones that are most susceptible to this virus.
Mhm.
And in addition to this, aside the age thing, other persons that may be more vulnerable are those that are careless. If you feel as a young person that you don't need to take precautionary measures, after all, I am in Africa. Disease does not kill an African man. You expose yourself. In fact, when you know that there is danger there, you tell yourself, Daniel was in the lion's den and he was not eating, he was not killed, forgetting that Daniel's situation is not your own very situation. If we do not take precautionary measures, preventive measures, we will be affected. We will contact the virus just like those that are aging, that are more susceptible. So that you're a young person is not an excuse for you not to take precautionary measures. For crying out loud, what will it take you to observe precautionary measures? It only shows that you're disciplined and you love yourself. Just do it for the sake of yourself and for the sake of those that are connected to you. So that's just about it.
Thank you so much. You see, we expect ourselves for the sake of love that we have for each other, for ourselves as well, so that the spread of this disease can easily be managed, and that we equally will be able to see our own loved ones surviving and not us contaminating them with the disease. And if I get what you said, is that nobody is exempted from being infected by this disease. And the next question I want to ask you is, how has this disease changed the lifestyle in Africa and the world at large? what is the change that it has brought in lifestyle for the people around and for
Okay.
Africa as well.
The disease
Yeah.
has really affected the socio-economic activities within the African continent. Those of us, I'll cite Nigeria as an example. I'll say that the social distancing really affected a lot of businesses. The lockdown at the time, the after effect of the lockdown is still being felt because at this time there has been hike in the prices of food items as we speak. At this time, some persons have not been permitted to even start work fully in this country. Some persons have
Mhm.
to stay at home, work from home. So there is this new appreciation for work from home style. You stay in your house, you work from home, the internet. People are now learning to become more internet savvy. People are now embracing the new normal. That in order for you to progress in this new economy, there is a new normal, there's a new economy. In order for you to progress in this new economy, the traditional method of doing things may no longer work. That is why some persons now have to embrace the learning of artificial intelligence. Some persons now have to embrace the use of reporting their work. Some persons now have to homeschool their children. The lifestyles have been changed a great deal. Now, some persons don't even stay up till late night anymore. Most persons that used to like clubbing a lot, they now have restrictions. Some clubs tell you the particular amount of persons that they would allow in the clubs because
Mhm.
of the social distancing and all that. Now, for schools, there had to be some stringent measures wherein schools had to segment into morning and afternoon schools, wherein you have students going to school for, let's say, 3 4 hours in order to be able to space them, then the other set will come in the afternoon. Now, how has this also affected the students and the parents? It now means that some children had to get home later than before, and some were susceptible to being raped, some were susceptible to being lured into things that were not supposed to. So the lifestyles have really been distorted in so many ways, both positively and negatively. And I'd like to say that because this has happened, we have had to also change alongside. We have also had to understand that having multiple streams of income is now very, very important because during the lockdown, a lot of persons became very depressed. Depression set in, some even attempted suicide, and some killed themselves. Even post COVID-19, there have been a lot of suicide cases. There have been a lot of depressive moments for people. Why? Because the lockdown brought a lot of consequences with it. So, one of the consequences we're trying to grapple with right now is how to move forward from now. How are we going to move forward from now? People need money to survive. A lot of people lost their jobs. People are trying to get by. How is the access to loans going to be able to help people? There have been provisions of COVID-19 palliatives, but have they gotten to the grassroots? Have they gotten to those, the end users, the people that really, really need them? A lot of things have really changed. A lot of the lifestyles have really been altered. And positively, some companies, some firms, some individuals profited. For example, Amazon at that time skyrocketed their sales and made a lot of profit during the lockdown and post lockdown. During that time, some people made profit, but the majority experienced losses. So the lifestyles were distorted, jobs were lost,
Thank you. Thank
children
you so
died.
much.
Yes.
Thank you so much. We gather from there. The lifestyle has been distorted. People are exempted from certain activities that they used to derive much pleasure from, and jobs were equally lost. Those are some of the aspects or effects that the COVID has caused, changing the lifestyle of Africans and making them some rendered redundant because the number of people at job sites actually have to be cut down. And we have noticed for quite a while that many people were equally maybe stuck in some countries when this disease broke out, and many presidents, if not all, were in their own countries. And I guess that with presidents being in their countries, much must have been done to be able to handle this virus. So, what has been some of the policy options that have been taken by African governments to face the spread of this disease, to face this crisis that is looming and affecting the world at large?
The truth is that very few countries have in Africa have the capacity to implement stimulus packages to cushion their economies from the effect of COVID-19. For example, some countries have put in place soft loans with little interest rates to help small businesses. That's what some countries, not without the help of the World Bank and the World Health Organization and all that support from them. Those are some of the policies that have been put in place by some of the countries in order to help small businesses and medium scale businesses, because a lot of these businesses they could not continue. A lot of these small businesses crashed. So the truth in this is that most economies need to be revived in order for the recession. There is an impending recession if actually the governments of different countries do not take up the responsibility of helping their individuals, their citizens. So if they put in place policy measures to help small businesses by giving out soft loans in order to help families, in order to help people that really need this help, to take away depression, to take away the thought that nothing can be done for them. This, in effect, can help. Some countries are already doing it. For example, in Nigeria, there was this COVID-19 palliative measure wherein household businesses were giving some soft loans without interest. Yes, they were giving some soft loans without interest, some without collateral, and it's still ongoing. Some persons were able to access it, and we still look forward to many persons accessing it. I know that that is happening in so many other African countries. So I think these policies will help a long way to cushion the impending recession
Yeah,
of
the policy
COVID.
of soft loans will go a long to actually curb the situation and equally salvage. But now, when you spoke, you said some households are being affected. I begin to think that the households you're talking about are those that are actually situated in cities and nearer to these credit facilities. What about those who are far in the suburbs? Are they equally benefiting from these measures? Are they benefiting from these measures that have been put in place? Because we have a problem of distribution and equally allocation of aid. Sometimes a particular area will be sidelined, and then others are just there, not getting even just the common face mask that we have to wear every day, which is already very expensive for some households. I mean, imagine a household of 10, you have to get 10 masks. Of recent, it has become a bit affordable. Do you think that the distribution of the palliative measures that you've just mentioned are equally uniformly spread without any bias, or worth of land being reached, especially at the peak of this.
Okay, I love this particular question because you have asked a humanitarian question. Truly, the distribution will not be as expected because of one or two shortfalls or shortcomings from the side of the organizers. But in the case that I can really talk about now, the microfinance banks were put in place to actually help distribute these loans. So, in effect, by situation, there are some microfinance banks that even those in the suburbs, those in the villages can really connect with. But the thing is, the information actually didn't get to the end user or those that really needed it, like you said, and that's part of distribution. So these persons may not have had access. For example, I'll talk about my own case. I had opportunity to apply for the COVID-19 relief loan for households, but lo and behold, it was approved 350,000 naira. I wasn't aware that it was approved. It was on a platform. So emails were not sent out. I didn't get text message. And guess what? There is a computer system that just logs out and declines the application on your behalf. Now, what you're saying now brings it to bear that a lot of persons will not have access to that because of the fault which came from the organizers, not that particular person, because I, as a person, I needed that money to cushion, to help my business, to cushion one or two effects, negative effects of the COVID-19 loan. Now, if I that had little stipends to still help myself could feel that way, imagine someone that cannot even afford $1 a day to feed. So truly, the distribution most times, especially in our African countries, is usually an it's a point for concern. But you and I can come in. That is where the humanitarian, that is where some global services.
Social.
This is
Thank
where
you so
you
much.
come in. We go in and cover up for where the lapses are. We'll get there. We'll get
We
there.
will get there. Giving up is not an option. Thank you so much for that submission. Something I noticed equally, we are talking about the effect of COVID-19 on socioeconomic activities in Africa and equally how this has affected families. You bear with me that prices of household items have a little bit increased, and then we equally have lockdowns, shops being locked up for some days, but then the taxes have not been reviewed. How do you think these other measures that are being put in place to soften the effect of the virus on the indigents, on the citizens, can actually be effective when the businesses are locked down and the taxes have equally not been removed totally, of course, because businesses are not booming. Imagine a market that could take 10,000 people, 50,000 people, now just 10,000 have to go in. Do you think that the sales can really make up for taxes if they are not removed completely, of course?
Okay. No, I don't think that sales can be made without the taxes being reviewed. Right here, transportation has increased. And when transportation increases, the prices of foodstuffs go up. And then you have those that come into the market to collect revenue from the market women, the salesmen. There. I can tell you from my own experience because I was with the market women leader for one of the markets in my state, and I had to field from her the experiences, and they said they are not having it easy at all because sometimes their wares have to be destroyed by the revenue collect tax collectors because they've not even sold for the day. They have not even been able to put money together to make up for their capital, not to talk of having to give out as tax. Now, in some cases, the taxes were even increased. In some cases, the taxes were increased. So, this is a serious burden on the individuals. Um, 2 days ago, it rained where I live, and the transportation had to go from 200 naira to 400 naira. Now, you see, the citizen is being made to pay for the rain falling. Just as COVID-19 happened, the citizens are being made, are being overly taxed, are being made to go through pain. They are being maimed. Why? Because they cannot actually afford this tax. So this is not helping the citizens at all. This is not helping. It is actually causing a lot of pain because some persons have closed their businesses. They said, I am just a sachet water seller. I sell 3 bags in a day, and you're asking me to pay 300 naira for the day for selling 3 bags of water. How much did I use to buy the 3 bags, and how much am I making from it? So the taxes,
Thank
if
you.
not reviewed, is more of a burden. Yes, to the people.
Thank you so much. If we don't review taxes, businesses are going to crumble, and we may find out the efforts that we are putting in place to make people feel comfortable, feel at home, will just be, a waste of time because they will just keep being disgruntled and never appreciate what we are doing. And now we are talking about businesses, taxes, traders not able to move up and down to get their goods equally, stock their shops because they are not sure that these things are going to be bought. And we are talking of an African continental free trade area, which we are thinking that is supposed to boom the businesses in Africa, that business is supposed to flourish, and people are supposed to move up and down around the continent to do business freely. How do you think this African continental free trade area can actually contribute in improving economy, of course, during this COVID-19 period?
The free trade area will go a long way to help a lot of businesses across countries, across the borders, because at the end of the day, instead of having to go through stress in doing trade from one country to another, from one particular location to another, there is this free trade agreement. There is this allowance for traders, for Africans to actually interact business wise and make profits for themselves. It will go a long way to encourage those in Africa that are interested in building the African continent. So the African Free Trade Zone will definitely go a long way to help because it will allow for free interaction, it will allow for free, it will cushion the effects of COVID-19 because there will be a robust interaction, there will be opportunity for businesses to expand beyond their country borders, beyond their particular site, and also expand. So it will definitely really, really help a lot.
All right, it is going to actually help Africa a lot if this is actually worked on and applied well, because the things can be there, and if they are not applied well, or if government policies do not support, we may not be able to what can come out of them. We are talking about effect of the COVID-19 on socioeconomic activities and on households, and we have seen that the virus attacks all sets of persons, children, adults, the age, and we are supposed to actually protect ourselves, show love for ourselves and others by protecting ourselves so that we prevent the spread of this disease. And equally, we are supposed to educate because there are some people who don't still believe that this virus is a reality, even though hundreds and thousands of people are perishing because of the virus. Thank you very much, Esther Ainabi, for joining me today in the studio to talk about COVID-19, a square peg, of course, in a square hole, being a humanitarian, an educator, and somebody who is licensed in public health I think you are just the best person who can throw us some light on this issue of COVID-19. And now we come actually to the raison d'etre of this talk today, which is the socioeconomic impact of COVID-19 to the activities that we talk about economy here and how this has affected families. And I would like to ask you, what are some of those socioeconomic shocks that COVID-19 has caused? Apart from businesses non-moving, what are those areas again, socioeconomic areas that cannot flourish because COVID-19 is just around the corner and seeming to last longer than we expected it to last?
Okay. Another aspect of socio-economic activities has to do with, we'll talk about tourism for most countries. I think that has really reduced because a lot of countries are not opening their borders to tourists to come in. And you know that some countries make a lot of money from tourists visiting their country. So, in terms of the economy, there is some part that is missing in terms of generating revenue. Then, social economic activities. A lot of people can no longer hang out the way they really want to. You have to restrict your party to just 10 persons. Why? Because you have to observe COVID 19 rules, COVID 19 precautions. Also, when the sports festival held in Edo State was to be done, there were select persons that were invited for the opening ceremony. Why? Because of the COVID 19 preventive measures put in place. When the governor won his election, the followers wanted to be at the stadium, but no restrictions in place. Now, there is this special interest, there's this enjoyment that comes from people gathering together. For example, in the evenings here, what happens with some folks is that once they are closed from work, they stop at certain joints. We call them bars here. They take what we call pepper soup. They take what we call shawarma. They take different kind of delicacies and all that. Now, those activities have been restricted. And I tell you the truth, no matter how much somebody works, no matter how much somebody tries to do so much seriousness in terms of work, you need to relax. For some persons, sitting down with their friends in large groups, not just two, three. Some persons just like to be in that large group and just tell you how they have been good for the day, how much they made, and just be loud like that. All that has stopped. And I tell you, when that is reduced, even the business, the person that is selling those things, the revenue, the money, the income the person gets is also reduced. And when there is reduction in the income, it affects the family because there are school fees to be paid, there are bills, electricity bills to be paid, there are certain emergencies that crop up. For example, when a child is ill, when that person actually needs to go for checkup. Now the businesses have been affected. This human interaction has been affected. A lot of online interactions instead of offline physical activities. So the social economic activities have been affected because the more people interact, the more people have time to converge, the more they have opportunity to interact as teams. It is easier to make money as a team. It is easier to make money. See, face to face contact sometimes can change the gain, the financial gain in a particular setting, compared to when you're talking with someone over the phone or over a Zoom call and all that. So these are aspects that have been affected by the COVID 19 insurgence.
Thank you so much. Many aspects of our lives affected, cultural activities, football, bonanzas affected, and we know that this used to generate much income to the hosting countries. And you see a stadium of about 10,000 having just 500 persons in attendance for a football match. This is much losses because much has been put in place to build the states, to clean them, and equally to disinfect, and no revenue can come in. You cited actually some other interesting activities there that people would have loved to commune together, but because of the distanciation and the preventive measures, they cannot commune together. And this really keeps people to have some psychological dissatisfaction, which may plunge them to psychological trauma. That's a debate that we may be coming back to it, how this can actually get people so affected. But I would like to ask you, food is getting expensive. People are supposed to be locked down. They're not supposed to go out. Do you think that the COVID-19 crisis may end up plunging Africa into more serious food insecurity crisis instead? Because people are, not carrying out their activities normally as they are supposed to do.
Yes, I believe strongly that the effects of the COVID-19 could plunge Africa into a deeper state of food crisis, because during the lockdown period was actually planting season for some of the crops that we needed for this particular time. That was a particular time that some crops that would have needed for now. So the production of crops for last year was really low. Why? Because a lot of persons had to be indoors and all of that. So it's actually affecting the availability of food. And you know, the scarcity of food will now increase the price of that particular commodity or those particular commodities. So because there's no low production, there's going to be increase, there's going to be more demand, and there's going to be increase in price rates. We're already experiencing it here. Imagine in lockdown, in a post COVID-19 situation, you're buying something that you used to buy before COVID-19 times three or times two the amount. It's not an easy thing because a lot of losses were incurred. And now, where are you going to get the money to be able to afford standard of living that you once enjoyed alongside your family, alongside your children? So, yes, it has the potential to plunge Africa into more food crisis. It has the potential, real strong potential, because the truth is that we are into agriculture. If we had enough of those foods that we usually have at this period based on planting at the right time last year into this time, we would have been exporting. We are losing money. We would have made export because we have enough. But right now, we don't even have enough. We have to import some. And importation means the prices will go higher. So, yes, if there's no cushioning properly, it could plunge Africa into deeper food crisis. I believe so strongly.
Hike in food prices, which will equally lead to shortage of food and plunge Africa again into food insecurity, which she is already suffering from because we have problems with food insecurity, shortages, of course, when we have so many vast lands and now people are restrained from carrying out their activities normally. Apart from people being laid down from their jobs, uh, we're talking now about the effect, how families are being affected, people being laid down from their jobs and all of that. Are there some other aspects that will really affect families as far as COVID-19 is concerned? We have 10 minutes to go. Time is
Okay.
always very short. The discussion becomes so interesting.
Okay, yes. Aside from people being laid off that, now I want to talk about the after effect. In fact, the resultant effect of a man or a woman being laid off his or her job.
Good.
Naturally, women were created to be taken care of. You will agree with me, my honorable hosts. And when a man cannot take care of his basic responsibility, there is going to be fracas, there's going to be chaos between husband and wife. Now, you see, COVID-19 is bringing problem in marriages. COVID-19 is bringing friction in relationships. Why? Because somebody had been laid off his or her job. Now, that is even the little side of it, because you quarrel to make up and get to understand each other when both of them decide to be rational. How about the state of a single person who thinks that I have lost my job? Now, what next? I am worth nothing. I used to earn 500,000. I used to earn 200,000 naira. And now I am being looked down on. I can't even pay my bills. I don't even have somewhere to sleep. Sir, suffice you to know that within the last 3 months, I have counseled over 50 suicide attempting people. In fact, some had already gone ahead to commit the act. They were saved by faith. Now, what does that tell us? It tells us that aside from the jobs being taken away from these persons, the emotional effect, in fact, the resultant effect emotionally in terms of the lifestyles of these people is something we really cannot write about. It's something we really cannot document, because you need to have a one-on-one interaction with this person to know what they are going through. There's mental stress. A lot of men are going into raping into children because they are jobless. That is not an excuse. That's not a good excuse. But when somebody does not have what he used to have to occupy him, just like I used to say, if you do not, as a government, occupy your youths, because they have that energy, they will channel it to areas that they think will satisfy them, whether negative. In fact, most times negative. So, in
Mhm.
this, a lot of emotional stress, a lot of debilitating effects. We've had a lot of things happen around us because of the effect, after effect of COVID-19. It's really not so palatable to talk about some of them. So I'll just stop here.
Thank you very much. We can enumerate most of these effects. We can equally add to that children being laid off from school because parents have lost their jobs and they cannot support them in school. We equally are seeing unemployment getting heights that were never there, and you can continue to list. And you will equally know that this family effect
I know that I know that the COVID-19 has been really, really hard on us, but it would be nice for us to understand that we are good together. We are a great force. So, welcome back, my host.
Thank you so much. Network is playing a fast one on us. I was saying that the effects on families are varied and numerous that we can continue to list them over and over and over. 6 minutes about to go. I would like us to talk about the vaccines. We have had viruses, we have had diseases, and there has not been so much noise about vaccines. So many varieties on COVID alone. What is your take about this issue of varied number of vaccines, and why so much noise, why so much panic, why so much no confidence, even by the medical practitioners? They are not confident even to accept this vaccine. Why so much polemics about a vaccine that is supposed to come to help us, but people are not sure if this vaccine is worth taking?
Okay, to a large extent, as a public health professional, I'd say that vaccines are used majorly as preventive measures against communicable diseases, against diseases that have the potential to wipe off generations, to cause um, life-threatening effects on people. So, with respect to the vaccines, I'd say that it's up to the individual that is involved to take the decision to have the shot of the vaccines or not. But from the side of the government, I think most of them are just afraid of losing more of their citizens. And as it happens that some of the presidents, in fact, majority of the presidents around the world fall in that age bracket that is susceptible, that are more susceptible to the infection, they will push for it to, for more research to be done on it. So the reason why you have different varieties of vaccines is because each company, each pharmaceutical company is trying to develop the best vaccines that will have less of adverse effect on the human system, because we know that each of these vaccines have their, some of them have side effects while some are just okay and all that. So in terms of reception of the vaccines, it's up to the individual. Okay, it's up to you to accept the shots. I think that should be left to the individual. Do you really think you need the shot? Do you really think you need to take the vaccine for preventive measures? Think about it. I'll leave that to you as a decision. I'm not going to make that decision for you because I am already making mine for myself. I don't want to be on the side of, oh, she told us during her interview that we have to go take the shot, or she said no, don't take it. No, I don't want to be on that side. I just want to be able to support whatever you decide. So that's my take on this.
Okay, thank you so very much. Your last word, because we have 3 minutes before we conclude. What is your last word to Africans who have listened to you, who are watching you this evening about this COVID-19 crisis? Your last word to your audience watching you out there.
Okay, dear Africans around the world, I'd like you to know that you are the best set of human beings created by God. And I'm so proud of you. I'm proud of how you have taken your life beyond your own very expectations. So, with respect to the COVID-19, good and fine, we have been able to overcome the COVID-19. Somebody saying, what? You're still in it. As you think in your mind, so it will be for you. And as you think it, take preventive measures. Always wash your hands. You go to the toilet, even when you use your tissue, ensure you wash your hands. Teach your children to wash their hands. Ensure your nails are clean, whether they're long or short, ensure they are clean, because there are so many microbes that hide in there that could cause other things apart from COVID-19. So do not be afraid of COVID-19, because COVID-19 can be taken care of with good hygienic measures. Ensure you maintain good hygiene. Ensure you look good. Above all, I want us as Africans to be united, united in all fronts. Let us stop tearing ourselves down. Let us stop selling ourselves out to those that do not want us to move forward. We are brothers, and let us keep the bond together. A luta continua, Victoria Aceta. We are on the winning side. I love you all.
Thank you so much. That was Eti Esther Ainabi, who is a humanitarian, a facilitator, a teacher, of course, and a lover of public, or she's a licensed public health practitioner. Thank you so much, Esther, for being with us. We are so elated. And we
Thank
see
you
that
too.
coronavirus is real. We should take responsibility of ourselves, and we have waged
Yeah.
this war up to this level. It means that we can make it. So let us respect the pronunciation. Let us wash our hands and equally put on our face mask. And remember that we have to protect each other by loving them, loving ourselves, and making sure that each of us survives till the vaccines get to really do what they are supposed to do. Thank you, Esther, so much. You will be invited again on our platform because you have much to tell us, and we are happy that you are joining us and to join the Sunpoint team to continue to promote this our agenda 2063. Thank you so much, and goodbye for now.